right, we're here with Phil. Hi, Phil.
Hello.
Phil, I want you to tell me a bit about what's going on with your neuropathy discomfort. I know that that's one of the reasons that you came beyond what your low back pain was and your knee pain.
Yeah, actually, it was high on my priority list once I realized that you guys worked with that also. And I have had diabetes for 26 years, and over a period of time, over the last 3 or 4 years, I had started getting a little bit of neuropathy in my feet, tingling sensations that would come and go. Over the last couple of months, though, I have noticed that it has pretty much stayed and not gone away. And naturally have concerns about that and where it's going. And I'm really hoping to get some relief off of the overall treatment plan. And we'll see where that takes us.
Okay, did you see any other doctors for your neuropathy discomfort?
Oh, I've been seeing doctors for my diabetes
For the
the
diabetes.
26 years.
Have they tried to treat it?
They've
Not the diabetes, but the neuropathy? Or is that all one of the same?
No, all they do is continue to watch, but really haven't come up with any type of medical treatments that was needed. I don't seem to suffer from the heavy pins and needles or the fiery feet, so there hasn't been any medications tried on that. It's just they've been keeping track of it.
So that's what we want to avoid, though. We
Right.
don't want to get that bad, and maybe there's still a ability to reverse that so that you don't have to feel the numbness anymore.
Yes, as through the treatment or the examination that Dr. Davis gave me, he feels there's an opportunity for us to try to help that.
What do you remember what your sensory loss was on that report? The sensory scale that Dr. Davis presented to you?
Was in the high 60s.
High 60% of loss. Oh wow! And how is that affecting your life?
Up until recently, it hadn't affected my overall life, but now that I noticed that it's staying, I'm concerned about balance and things that go along with that.
Because you read up on it and you know that people suffer with balance, or
Right.
or you're feeling it happen.
Well, it's not so much that, it's that where I come from in Michigan, doctors don't seem to be up to date with some of the possible treatments that might help improve the blood flow and things that I've probably lost.
Okay. Well, we have some things that we're going to present to you. I have something ready to present to you, and then we'll just keep an eye on it and see where you're progressing. All right. Thank you for your
Sounds good.
story.
Hi, it's Dr. Robert Davis with Active Health Knee and Shoulder, and I am here with Phil, and Phil was kind enough to come on the program and just talk about his experience in the office. Phil came in for neuropathy and knee pain, and he's been getting great results with both, so we wanted him to actually go over his experience with his neuropathy. So if you could, Phil, just tell us the reason why you came to our office, how you found us, the problems you were having, the challenges you were having, and then the experience kind of from the first day to where you are right now.
Well, first of all, I am a diabetic, and my neuropathy has been there for a while, but it continually got worse, and all of a sudden it seemed to take a real big change and a tremendous amount of numbness. And I happened to, and my knee was bothering me also, and I happened to be looking on the internet, and that's where I found you for the Active Knee and Health.
Right.
And that's how we got the acquaintance going that way. And then when I got here, I realized you did neuropathy too.
That's right.
And that was a tremendous thing that's happened for me at this point, because the numbness was so bad at the beginning that it created no feeling at all. And now through the treatments and stuff like that, because I've been testing myself on the bottom of my feet, trying to do light touches and stuff, and I can really tell the difference.
Oh, that's fantastic.
So I'm really happy with the results that we're getting out of this, I'm hoping, I don't expect to get back to 100% like normal people because of the diabetes, and I've had it for such a long time. But it is a lot better, and I'm continuing to use the home treatments that you had me do, and I'm looking forward to getting it as good as I can.
Absolutely. Could you just tell us a little bit about the home care? Like, just, is it a difficult thing for you to do? Do you find it easy? Is it easy to fit into your daily routine?
The aspect is that it's like anything else new.
Mm-hmm.
You have to be committed to what you want to try to do and what you want to accomplish, because it's easy to apply, and it's
Right.
easy procedure to do, but to change your actual nature of what you do on a daily basis took a little while to get that going. But
Right.
but my commitment was strong enough to make sure that I was doing the treatments twice a day,
Right.
and with the light therapy and also the like TENS type unit that's being used on.
No, right, the nerve re-education.
Right.
Yeah.
So once I got into that routine, I made that my top priority.
Right.
And it's just like anything else in life. You have to decide what's going to be your top priorities, and I made that my top priority, and that's working out. And I continue to start fitting more and more things in my health and wellness program that
Right.
I'm doing with you.
So what do you typically do when you're doing your therapy? Because it's passive treatment, right? You apply it and you're sitting there. Do you read, watch TV, or what do you
There's
learning
some-
anything new?
Sometimes I'll do TV. Sometimes I'll be sitting at my computer
Oh, okay.
while it's
Yeah, you can
going,
do that too,
and
sure.
and fulfill some other things like that.
Okay.
Because I kind of like, my hobby's kind of like watching the stock market. I know that drives some people crazy. But,
Sure.
But the aspect is that I was going to be doing that anyhow, and it doesn't disrupt that.
Right.
It's just making sure I got the proper setup.
Right.
And going with that. And my wife's been very understanding too, because I take care of our dog most of the time. Like,
Okay.
when he needs to go outside and stuff like that, especially with this coronavirus.
Right.
going around.
Right.
And so making sure that I fit that in. She knows that if I'm in the middle of my treatment, we wait until we get that one section done,
Mhm.
and then we do whatever we want to do. So it's worked out very well.
I'm very happy for you.
Thank you.
Thanks for sharing. It's going to help a lot of people. And at this time we have the ability to heal at home, really, because we don't have any choice. So everybody's at home. So this is a perfect opportunity. If you've been putting this off, you're at home anyway. Why not take that time and heal at home? So thank you very much, Phil. I appreciate you coming on. Thank you.
You're welcome.
Hi, it's Dr. Davis with Active Health Knee and Shoulder, and I am back with Phil. And Phil was kind enough to come back on and kind of give us an update with his neuropathy condition that he's been treated for in this office, and he's also doing a lot of therapies at home. So he's noticing some good things, some changes, and I wanted him to kind of explain the changes that he's noticed. So Phil, if you could just kind of explain what we were talking about earlier.
Okay, well, 2 weeks ago, we had a little conversation once again,
Right.
and I gave you an update on that I thought we were improving or whatever. But since then, I've even noticed in these last 2 weeks, as I'm doing the rebuilder process,
Right.
I'm getting more and more feelings in certain areas of where maybe blood flow needed to go or whatever.
Right.
And it seems to be concentrating on doing better repairs. I did have an injury on my toe
Okay.
that you knew about, and it's still at its final stage of healing.
Right.
But that's where I felt it the most in the last weeks.
Right.
Here,
Right.
that it feels just like there's a surge going right to the toe.
Explain like the sensation, like what you're actually experiencing. What does it feel like?
It feels like it's actually little pulsations type situations,
Okay.
and that's what I meant by that, when maybe the surge of blood
Right.
going there, because it pulses every couple of seconds, like into there,
Yep.
and until the treatment is over, and then of course things start to go back a little more to normal of where I'm at. But as I'm doing the treatment, I can actually
Right.
feel that sensation now.
would you say, is it painful? Is it an uncomfortable sensation, or just kind of an odd sensation?
No, it's just a little bit different. It's just like somebody trying to give you a little poke, but it's a very light poke.
Right, right.
And then it pulls back, and then it
Awesome.
hits it again.
So I wanted you to come on because I kind of want to explain what's happening. So when people start to get neuropathy, the numbness and tingling, the burning pain, the coming and going of all these sensations is actually the nerve dying. It's the pangs of a nerve that's trying to survive an environment that doesn't have proper oxygen and it doesn't have proper blood flow and nutrition. So it can't survive, and it feels that, and you actually feel the pains of that nerve dying. So when your body starts to heal and you do the therapies, because Phil's been great, he's been doing all the therapies, he does a lot of things at home, and what we're doing is increasing nitric oxide blood flow, we're retraining the nerves and the energy, and now what's happening is he was completely numb for a while. Actually, we had to be real careful with the light because it was burning you and you didn't feel it.
Right.
Okay, so you have to be really careful with that stuff, because people with neuropathy don't have any feeling, and sometimes they think, oh, well, I don't feel anything, so I'm okay. That's not okay. That means the nerves are dying. So if you're at 80% loss in my office, I can't see it. You're too far gone. So that's the sensations he was getting before, and now he's starting to get the sensations where the nerves are coming back alive. So he's actually nourishing them with oxygen and nutrition. And so even though it's a weird feeling that he's getting, it's a good feeling because those nerves are coming back to life again. So thank you very much for coming on, and maybe we'll do an update in a couple weeks as well.
Okay.
All right.
Thanks.
Thanks.